Hello viewers, welcome to JD Pharmacoveda on a very new drug called Salmeterol. Let's start this video with an amazing quote written by B.B. King. His words are like, "The beautiful thing about learning is that no one can take it away from you." Moving to the drug Salmeterol. Salmeterol is a long-lasting beta-2 adrenergic receptor agonist and is currently prescribed for the treatment of asthma and chronic obstructive pulmonary disease. Mode of action: Salmeterol acts for longer duration than the short-acting salbutamol and relaxes the airway smooth muscles. Salmeterol dilates the bronchial smooth muscles by increasing the cyclic adenosine monophosphate through beta-2 receptor stimulation. Actions: it is inhaled twice daily as maintenance therapy in case of nocturnal asthma but not for acute symptoms. Combined use of inhaled salmeterol and inhaled glucocorticoid produces effects equivalent to the double dose of corticoid alone. They reduce breathlessness by preventing the expiratory closure of peripheral airways and also by abolishing the reversible component of airway obstruction in COPD patients. Dizziness, sinus infections, migraines, headaches are some of the common adverse effects we see in case of salmeterol. Salmeterol is given 25 microgram as puffs twice daily, and in severe cases we give 4 puffs twice daily. Thank you all watching this video. Let's come up with another drug on the next video.